The patient I'd like to talk about today is a young man named David. He was noticing a lot of frontal hair loss and some recession in the corners, and wanted to be proactive. We had a very clear understanding. We were not aggressively trying to create a 17-year-old version of himself, but an age appropriate for someone in his mid-20s that would also stand the test of time. The number of follicles required to meet his goals was around 12 to 1600. So we looked at the area we were looking to cover, we looked at the density that we hoped to achieve, and our target number was just over 1400 follicles. The design phase of the hair transplant is a very important part of what I do, and it shouldn't go underappreciated when people are doing their research. There's surgical technical expertise and there's medical knowledge, but the aesthetic component that has to be brought to bear to bring this all together is really paramount. It's very important for a patient to recognize that the goal is to always appear natural, whether you're 25 or 65. And by design, there are subtle irregularities. It's not opaque. It looks soft, it looks natural. If you look closely at the transplanted hair, there is never going to be a straight line. You know, this whole area in the center was reinforced, but you know, you got a lot of hair.
I chose to have a transplant. It was like a kind of a long decision for me because I didn't really know if I wanted to do it, and I think after talking with you about the options, I realized that I did want to go through with that because it's just something that I wanted to do. You know, be proactive about it as a young person and do it while I'm still semi-present in this area. I wanted to be close to home, which is one of the reasons that I chose Connecticut as a location, and then I looked up reviews online and saw you had a lot of good reviews and some good success, and I came here and you were very convincing, and it's been a great experience overall. It looks really, really good.